I'm Dr. Jasmine Brown, naturopathic doctor and labs medical program manager here at Fullscripts. And it's so wonderful to have you here for the second session in our series on vascular and endothelial health. If you missed our first session, during which we explored the metabolic risk panel and how it helps clinicians catch metabolic and cardiovascular risk early, don't worry, you can always watch the recording later at fullscript.com/webinars in a couple of days. In this session, we will discuss how endothelial cells maintain vascular integrity, as well as the potential of a green seaweed extract in preserving endothelial function. Leading this session is Dr. Derek De Silva, a practicing internist and senior attending physician at Raritan Bay Medical Center. He is a member of the teaching faculty at JFK Medical Center and has held leadership roles in the Age Management Medicine Group and the American Nutraceutical Association. As a recipient of the Alan P. Mintz MD Award for Clinical Excellence, Dr. De Silva has been recognized as a Castle Connolly Best Doctor for 19 consecutive years. He is also a medical correspondent for Cablevision News 12, New Jersey, host of Ask the Doctor on WCTC Radio, and a published author. Before we get started, a few quick housekeeping notes. Please submit your questions to the chat, and we'll address as many as possible after the presentation. This webinar is being recorded, and the recording will be sent to all attendees and registrants via email. You can also access it at fullscript.com/webinars in a couple of days. A copy of the slides is available for download in the file section of the platform. And there will be a 5-minute break between each session. So feel free to stretch, grab a drink, jot down any notes, or go to your Fullscript account and favorite the test for easy access in clinic. Thank you again for joining us. Take it away, Dr. De Silva.
Well, thank you very much, Dr. Brown. It's a pleasure to be here, and I'd like to say thank you to Fullscript and also to Calroy for allowing me to do this presentation. Here's my disclosure, and here is a disclaimer, folks. We're not here to treat or diagnose anything. We're here to just give you some great information. That's what this is about. So learning objectives. I'm not going to read all of this to you because all of you can read. But, basically what we're going to talk about here is endothelial dysfunction, endothelial cells, the role of nitric oxide. How does endothelial dysfunction really have an effect on your system? What is rhamnan sulfate? What is Monostroma nitidum? And also, what are the specific groups that could benefit from this particular thing? Folks, heart disease is still the #1 killer in this country. Every year, 600,000 people die of heart disease. Every 32 seconds, somebody in this country has a heart attack. We go back to the risk factors for heart disease. And I will always say diabetes, high blood pressure, smoking, sedentary lifestyle. You will rarely hear me say cholesterol, because cholesterol for me is a very protective entity within our bodies. So focusing on, as the last speaker did, Mr. French did, was on the idea of inflammatory markers, diabetes, hemoglobin A1C, insulin, apolipoproteins, LP(a). These are some of the important things that we have to look at, because we know that vascular disease, cardiovascular disease, is an inflammatory condition. And again, this is all a little redundant for all of you, but a lot of times the first sign of vascular disease is a heart attack or a stroke. And if you look at the statistics on this, the amount of people with undiagnosed hypertension, the amount of prediabetes, the amount of diabetes, and half of the people that have diabetes don't even know that they have diabetes. What about peripheral arterial disease? And how often are we really ordering tests that really give us and tell us and direct us as to where to go? This is where apolipoprotein or ApoB comes in, apolipoprotein B comes in. This is where LP(a) comes in. This is where insulin levels come in. I've been doing apolipoprotein levels and LP(a) levels and insulin levels in my practice for years. People are not going to lose weight. They will not lose weight unless they have their insulin levels are low. By the way, I don't have a timer clock up here that I can see. So anyway, um, so making sure that we look at all of these things are really important. So the vascular health, which is really our gateway, right? If your vascular system is not working the way it should, then the whole idea of disease state, pathology, vascular disease really starts to come into play. And that's really what we're going to talk about today. But there is good news, right? We can cut down inflammation. We can show you how you can really make a difference when it comes to your vascular health. And what is the endothelium? Well, the endothelium and the endothelial dysfunction. So we all know, and I'm going to jump to this, but really the vascular health is characterized by the correct amount of nitric oxide production, decreasing inflammation, making sure that the blood vessels work and do what they're supposed to do. And I'll go through this and you will see how the endothelial layer, that single-celled layer, and the layer above it, which is what we're really going to focus on today, makes all the difference in the world. So what is this endothelial layer? It's a single-celled layer that covers every single vascular system in our body. So it's the arteries, the veins, the lymphatics, everything. The endothelial layer covers all of that, and it is a metabolically active organ. That is what one of my messages to you is that it is metabolically active. It's not just sitting there. It does a lot of different things within the body. It produces all of these vasoactive substances to help maintain vascular tone. It also helps repair oxidative stress. And if this endothelial dysfunction continues, if the dysfunction of this layer continues, this is one of the markers, if you will, for vascular disease. And I'll read this last line to you, and this is important. All vascular risk factors are associated with endothelial dysfunction: diabetes, high blood pressure, smoking, sedentary lifestyle, insulin levels elevated, etc. And it precedes the development of morphological vascular changes and manifestations of cardiovascular disease. So we've made a lot of progress when it comes to vascular imaging, cardiac catheterizations, vascular imaging in general. But here's what really got me when I first saw this picture. So during my residency, I remember going into the lab, to the echo into cardiology, and I always saw this area where these arrows are on the slide of that little space. And I always said to myself, and in fact, I asked one of the head of cardiology, I said, why is that space? Because we know that the blood is the darker piece in that vasculature. What is that space? And I really didn't get an answer, but I got an answer about, oh my goodness, about 15 years after I finished my residency. So I finished my residency almost 40 years ago. So I've been doing this quite a while, and I've been working with this on this particular project for over 20 years. This is something that's been very near and dear to my heart. But what this layer is this, I don't know if you can see my pointer, but this area right here. And if you look at this hairy gel-like projection that comes up, that is what we are going to focus on. That is the endothelial glycocalyx layer. It is a slippery, gel-like layer that is on the surface of every single blood vessel. So what is the glycocalyx? If you take a fish and you hold that fish as soon as it comes out of the water, it's very slippery and it's very hard to hold on to. That fish, that outer surface of the fish, is a glycocalyx layer. It's slippery and it's gel-like. And if you look at this, and if you look at the way this all works, this is a pictorial of what this really does. So this is the endothelial layer here. It's a single-celled layer. And these blue lines are the glycocalyx layer. So again, it's protective. It is a protective layer that has selective permeability, but it is metabolically active. That's important because it helps regulate surface inflammatory response, arterial anti-adhesive factors. It harbors various coagulation regulatory factors, houses extracellular superoxide dismutase, and it also triggers the production of nitric oxide. Very, very important. And I'm going to get into that in just a second. But this is the endogenous production of nitric oxide within the vasculature. So this is, again, another pictorial of what is going on. What is this layer made of? This blue layer is made up of peptidoglycans, glycoproteins, aminoglycans. These are all complex sugars that have metabolically active substances and produces metabolically active substances. So if this layer decreases, so if we lose these blue lines within this layer, what's going to happen? We reduce nitric oxide availability. That's my next slide I'll talk about. It increases oxidative stress because now, what are you doing? You're now exposing this endothelial layer to the damage. As I said before, this layer is a protective layer. You cannot get to the endothelium if this layer is intact. But if you lose this glycocalyx layer and the endothelium now is exposed, what's going to happen? You increase oxidative stress, you increase leakage of macromolecules, you increase platelet adhesions because there's a place for them to stick now. There wasn't a place for them to stick before. You increase thrombin generation, you increase leukocyte adhesion, and all of the factors that go with that. So again, what does this do? This is a very interesting thing that the glycocalyx does. So this is called shear stress. As the blood flows across that blue layer, as the blood flows across this layer, what happens is that nitric oxide, just by the flow of blood, produces what is called a shear stress, and nitric oxide levels increase. If you lose this layer, what's going to happen to nitric oxide production? It's going to decrease. It is going to decrease dramatically. So here's another question to you. Where do we get the most adhesion and damage, plaque damage within the vascular system? It's at bifurcations. Why? Because you change flow from linear flow, and as soon as it hits a bifurcation, it goes from linear to turbulent. So turbulent flow is what also has an effect on damaging that glycocalyx layer. So we want to keep that layer thick. We want to keep it healthy. And what decreases that layer? Diabetes, inflammation, high blood pressure, increased flow, cigarette smoking, oxidative stress, lack of movement, etc. So this is the mechanism of how this happens and why this works. And again, this is another pictorial. And I love this saying, like the microbiome, you can support it and you can do something for it, but it's a very, very delicate layer. So we have to take really good care of it because inflammation, once again, is what is going to destroy this. So how do we do that? And how do we protect it? And this is where some of the work that I did 20 years ago, along with some very, very smart scientists, came in. There's a marine-based polysaccharide that has this almost the identical structure as this glycocalyx. So it's like bricks in a driveway. If you break a brick, how do you fix it? Because water's going to get in it. It's going to damage the entire structure. How do you fix it? You put another brick on and seal it. And it's exactly what happens here with this particular green seaweed extract. This particular green seaweed extract was studied in a patented way in something called a microfluidic chip. So we were able to put various substances into this microfluidic chip that mimicked the effect of the glycocalyx. And we were able to study numerous substances to mimic the effect of the glycocalyx. The one that really stood out as we looked at this, and we've known this, but to verify and confirm the data on this was when this particular technology was developed, this particular microfluidic chip. So we were now able to use this green seaweed. It's called Monostroma nitidum. Say that twice, right? Monostroma nitidum, that produces this very potent substance called rhamnan sulfate. It is, again, a very similar structure to what you find in the glycocalyx, the building blocks of that glycocalyx. So taking that, we were able to show by introducing that the rebuilding of this particular layer. And folks, I cannot begin to tell you how critical this has been in my practice and what I do through this. So again, a very powerful, potent extract called rhamnan sulfate from this seaweed called Monostroma nitidum that we looked. And here's the data. The Monostroma nitidum restored glucose-damaged human glycocalyx up to 103.8% of its pre-damaged state. And it did so in a short period of time, which was 24 hours. It is extremely well tolerated. I've been using this compound for over 20 years. Over 20 years, I have been on this particular compound, and it is absolutely remarkable. So, this was a study that was done in 2023 that demonstrated that rhamnan sulfate had a protective effect on supporting healthy blood sugar levels, healthy vascular inflammatory response, and helping support the health of the endothelial glycocalyx. So again, just as a takeaway, to be a little bit redundant, the damage of the glycocalyx precedes endothelial dysfunction. The damage of the endothelial glycocalyx is related to a decreased amount of nitric oxide production. Rhamnan sulfate from Monostroma nitidum. Rhamnan sulfate is the compound. Monostroma nitidum is the seaweed, is a very powerful and a very safe rebuilder and a supporter of the glycocalyx. It's important for vascular health. It's important for nitric oxide production, and it's important as a nitric oxide producer. Who should be on this? Folks, anybody over the age of 40, anybody that has vascular dysfunction, people that have sexual dysfunction, specifically men and women with erectile dysfunction. And I use this all the time in my cardiovascular patients, in my diabetic patients, in my hypertensives, and also in my smokers. And folks, you got to stop smoking. It's that simple. And individuals with acute and chronic inflammatory conditions, specifically autoimmune disorders, traditional insulin resistance, which throws us into the diabetics, the hypertensives, the tobacco people, and all of the other gut issues and some of the things, the toxins, infections, et cetera, that people have. So these are some of the uses of this particular compound. Again, people with men and women that have these issues are excellent candidates for this particular compound. I love it. I personally use it, and I've been on it for a really long time. So thank you once again to Fullscript and Calroy for allowing me this time to present this wonderful data.
Thank you so much, Dr. De Silva. That was so wonderful to hear from you. We do have quite a few questions. So are you ready?
Let me finish my vodka. I'll be fine. Hold on. No, I'm ready. Go ahead.
Okay, so the first question, I think you kind of answered, but I'll ask. What is the time frame on damaging and repairing the endocalyx? Meaning,
I know
it.
what you mean. I know
Oh,
what you mean. So, okay. So, what happens here is any kind of vascular dysfunction, right? For example, you smoke a cigarette, right? Your blood sugar goes up to 400. That, and I'm going to use just a pictorial if you don't mind. Let's say the glycocalyx is this thick. You smoke a cigarette, your sugar goes up, it diminishes. Okay, so now what happens here, Dr. Brown, is that that becomes your baseline. When
mm,
you eat, it goes down a little bit more. So and because there had, remember I told you it's a layer for absorption and permeability. So nutrients do go through that, right?
yeah,
It takes about 6 hours to rebuild that layer. But the real rebuild happens over about a 24-hour period. So you want to control that inflammation. And we know by some of the studies and data that we've done that when you take this, the effect is something that's going to work and it's going to build over the 24 hours.
awesome. So this is basically answering our next question. Can the glycocalyx layer be regenerated?
Yes, yes, it can. It can.
Awesome. So the next question is, can you test for glycocalyx health?
Well, there have been some tests. We've done some of the tests in the past. The problem with some of the tests is that they don't really tell you what we can do. What we can do is we can measure nitric oxide,
Mhm.
right? We can use some of the saliva strips to measure nitric oxide. We can say, okay, if your nitric oxide layer is X, and you use the glycocalyx, it's being built, it should then improve. So there's some testing that we can do, and there's some other compounds, obviously,
Mhm.
that we can use. But yes, there is some basic tests that we can look at.
Awesome. Okay, so the next question is, does the green seaweed extract help stabilize or reverse calcified coronary arteries?
Well, that's a very, very good question. So there was a study that we did with plaque, right? We looked at the plaque in the coronaries. What and this was done. I'm not sure that this was done with Calroy or through a different company because I know that I was involved in one of these. We did show that there was some improvement in that coronary plaque. Now, the question though is, are we able, and this is the critical question, are we able to stabilize soft, friable plaque? Because hard plaque is not the issue. We all know that, right? Hard plaque is not the issue. If you've got soft plaque, if you've got friable plaque, are we able to stabilize that? Possibly.
Oh,
Possibly.
so there's an effect, which is just not as clear.
Yeah, I think that, and if you really look at this, and there's one of the PhDs that works with us,
Mhm.
is really the question. It's something that I'd like to throw out to him because he does a lot of the research, and perhaps we can forward that question, whoever asked it, to him to get a little better idea. But my impression is that if you can stabilize the plaque, that's really what you're looking for by helping support the health of the glycocalyx. It just makes sense.
Yeah, awesome. I love that take on that. Thank you for answering that. That's like you said, it's a good question. All right. So the next question is the seaweed extract okay for patients with Hashimoto's?
Yeah, exactly. We talked about autoimmune disorders, right? Autoimmune people with, this is the big thing, is people with autoimmune disorders, they have leaky gut, right? We know that that's where it starts. It starts with the leaky gut. The leaky gut then leads to what? Inflammation. From the inflammation, it goes to the damage to the endothelial glycocalyx. From that, we go to what? Vascular disease. We know that
Yeah.
we know that in this group of patients with autoimmune disorders, there's tremendous inflammation and damage to the glycocalyx. So the answer is yes.
Awesome. Um, Next question is uh, someone saying that they are curious about what you have seen with the use of the GLP-1s to improve the vascular endothelial lining, as lots of research is coming about the benefits of those.
Well, I'm going to tell you right now, as an internist, as somebody who sees a lot of these disorders, I have maybe written a prescription for two GLP for two patients. Why? I think that it's a great moneymaker. There's no question, right? But when you look at, is it really benefiting people? What's going to happen when they stop? We know as soon as they stop, the weight's coming back. If somebody is 350 pounds and you need a jump start, no problem. I will help you with that. I will get you on it. I will get you on the right track. To answer your question about the idea of the GLP-1s having an effect on the glycocalyx, I don't know. Is it something that we can put into our microfluidic chip and look at? Possibly. But I will tell you this. The reason that it could possibly work is because of reducing inflammation, right? It can have an effect on reducing inflammation by reducing sugar, reducing all of the metabolic factors with weight, and reducing inflammatory markers. That is where I think the effect comes in, the possible effect comes in.
That makes perfect sense, actually. Okay, thank you for your insight on all those questions. I do have one more for you before we wrap up. That question is, what are you most excited about for vascular health in 2025?
So, as I said before, I've been doing this for almost 40 years, Dr. Brown, and I have seen how devastating cardiovascular disease is. I always said to myself, this whole cholesterol thing makes me crazy. So it's not something that, but what I do know is that diabetes, high blood pressure, smoking, sedentary lifestyle, high insulin levels, elevated LP little a, elevated apolipoproteins are all risk factors for cardiovascular disease. And I always thought about, how do we fix this? What do we really do? How can we really help people? Yes, we can control the diabetes. We can smack them around if they still smoke and tell them, Doc, what's the matter with you? How can you still smoke? What are you, nuts? I mean, come on. But to give them a little bit more and say, oh, we have one more thing that you can use to support your glycocalyx, to support the endogenous production of nitric oxide and help with vasodilation, is for me really nice. And I'll tell you what, for my patients with vascular disease, for my patients with blood flow issues, and you know what I'm talking about with things like ED and all the other issues, it's been a game changer. It's been phenomenal. So I'm excited about it because it's another arrow in our quill that we can use to help people.
Wow. Well, you got me excited too. This has been really great. I just want to say thank you so much, Dr. De Silva. And thank you all for attending and participating in today's session. We hope that you found it valuable and gained some new insights. If we didn't get to your question, please feel free to reach out at support@calroy.com. A quick reminder, the recording of the session will be sent to all attendees and registrants, and you can also access it in a few days at fullscript.com/webinars. We'll now take a 5-minute break before the final session. I invite you to join me for Streamlining Whole Person Care, Clinical Tools for Vascular and Endothelial Health, where I'll share practical strategies to help you implement whole person care in your clinical practice. I look forward to seeing you there.